Is clozapine safe during pregnancy? Have you ever wondered about the safety of medications during pregnancy, especially for those dealing with schizophrenia? Today, we are focusing on clozapine, a second-generation antipsychotic, also known as Clozaril. This medication is often prescribed for individuals with schizophrenia who have not found relief with other treatments. When it comes to pregnancy, the safety of clozapine is a topic of great importance. Research indicates that clozapine does not seem to increase the risk of birth defects compared to the general population. In fact, studies show that the rates of birth defects in pregnancies exposed to clozapine are similar to those seen in the general population. These rates typically range from 4% to 8%, which is not higher than usual. However, it is essential to be aware of some specific risks associated with using clozapine during pregnancy. Pregnant women taking clozapine may have a higher chance of developing gestational diabetes when compared to those not taking antipsychotic medications. Additionally, there have been reports of certain effects on newborns, such as floppy infant syndrome, changes in fetal heart rate, and, in rare cases, seizures in infancy. Clozapine can cross the placenta and is also present in breast milk, which means it can affect the baby both before and after birth. Monitoring becomes crucial for women with schizophrenia who are on clozapine during pregnancy. Healthcare providers may recommend regular blood sugar checks to monitor for gestational diabetes. After birth, doctors may keep an eye on the baby for any unusual symptoms. If a mother is breastfeeding, her healthcare provider might suggest testing the baby's blood for potential effects of clozapine, including a rare but serious condition known as a granulocytosis, which impacts white blood cell counts. It is important to note that much of the information on clozapine during pregnancy comes from small studies or individual case reports. This means that the complete picture is not entirely clear. Factors like the mother's mental health, lifestyle choices, and use of other medications can all influence outcomes. For women with schizophrenia, stopping medication during pregnancy can sometimes pose more risks than continuing treatment. Stopping medication may lead to a relapse of symptoms, which can be harmful for both the mother and the baby. Therefore, the decision to use clozapine during pregnancy should be made in consultation with a healthcare provider. This decision involves weighing the benefits of managing schizophrenia symptoms against the potential risks to both the mother and the baby. If a woman with treatment-resistant schizophrenia becomes pregnant, her healthcare provider will likely review her treatment plan and discuss all available options. The primary goal is to ensure the safety of both the mother and the baby while effectively managing schizophrenia symptoms. Regular checkups and close monitoring are standard practices for women taking clozapine during pregnancy. In summary, while clozapine is not considered unsafe for use during pregnancy in women with schizophrenia, it does carry some risks that require careful management. Balancing the need to control schizophrenia symptoms with potential risks is essential, and decisions should always be made with medical guidance.